Healthcare works best when it's proactive, dealing with problems before they turn into a crisis. And it's the same for our healthcare system. We need to deal with problems before they turn into something bigger. But our system may appear pretty healthy. We have 2 big hospitals that handle A&E and inpatient care, minor injuries units, over 60 GP surgeries, and a network of other services that serve the 650,000 of us who live here. The thing is, our healthcare needs are changing. As a population, we have a growing birth rate and we're living longer. So our healthcare system is having to deal with more long-term care needs, things like cancer, diabetes, heart disease. We're starting to see warning signs and hearing about problems, and it's not just coming from patients, it's coming from the whole spectrum of NHS professionals across our region too. We're starting to see that our network of services is too fragmented to cope with the new challenges, and it's becoming unsustainable. And a system that's starting to be strained means it's harder to attract and keep the right expertise. A plan for the future needs fresh thinking. So we gave our staff and patients a blank sheet of paper and asked them to help design a system that would meet these new challenges for at least the next 20 years. Over 300 of them took up the challenge. This is the basis for Future Fit. We need an emergency centre for people who need help when it's a matter of life and death. And we need a hospital for more routine surgical care. But at the moment, these services are spread across 2 sites, 18 miles apart, which means our skills and resources are split. So the first step is to pull these specialties together. An emergency centre can bring all our emergency staff and resources together to create a world-class centre for people with life-threatening illnesses or injuries. Which means we can keep the 80% of hospital treatments that are routine, operations, x-rays, scans and some cancer treatments, with the specialists and beds needed in one place, in a specialist planned care centre. This means we won't need to cancel operations when the system overflows. Urgent care centres, sited at both major hospitals, and enhanced rural urgent care services will be better placed to see people who need care that day, but whose cases are not life-threatening. And we can take advantage of advances in healthcare technology, meaning we can do a better job of providing care and preventative treatments right where people live, right in their homes, meaning fewer people will need hospital treatment. For our plan to work though, we need support and feedback, not just from healthcare professionals, but from all of us too. There's a vast amount of work to do. But the bottom line is that it has to work for all of us, and for our children, and for their children. You can find out more about these changes and how they'll affect you, and you can give us your input on how to make our NHS fit for the future, right here, nhsfuturefit.org.